1/3 of the world's population is infected. According to the CDC, TB is the leading killer of people who are HIV infected. In 2011, 9 million people around the world became sick with TB. 1.5 million died. Tuberculosis was discovered by Robert Koch, father of microbiology, but it's thought to have plagued humanity since the time of the Egyptians. In studying this disease, the acid-fast stain was developed.
What is tuberculosis? Tuberculosis is a disease caused by the bacterium Mycobacterium tuberculosis. It is an aerobic bacteria that attacks the lungs. It needs sufficient oxygen to remain stable. It can also attack other parts of the body. If not properly treated, it can be fatal. There are two forms of tuberculosis. The two forms are the latent TB infection and active TB infection. The latent TB infection lives in the body without making the host sick. If the immune system of the host cannot stop the bacteria from growing, it may become active.
How is it spread? Inhalation is the most common way in which TB gets into our bodies, taking in bacteria which are suspended in dried dust or in tiny droplets of someone with active infection. People nearby may inhale the bacteria and become infected.
Symptoms and incubation period. These are the symptoms: a bad cough lasting 3 weeks or more, chest pain, coughing up blood or sputum, weakness, fatigue, weight loss, loss of appetite, chills, fever, sweating at night.
There are two types of tests to detect TB. This is a TB skin test, where a small amount of tuberculosis is injected into the arm to be read after 48 hours. If the results are positive, then blood and chest x-rays are used to determine the activity of the disease.
Treatment and prevention. TB can be treated by taking several drugs over the course of 6 to 9 months. It is very important to finish taking all of the medicine. If an individual stops taking the medication too soon, he or she may become sick again. If not taken correctly, it can lead to the development of drug-resistant TB. If you have latent TB infection, your healthcare provider may want you to be treated to keep you from developing TB disease. If you think you have TB, contact your healthcare provider or local health department to be tested for TB infection. Be sure to tell your healthcare provider if you've spent time with anyone who has TB disease.